My name's Connolly. I'm a GP with special interest in gynaecology and a hysteroscopist from Bradford, and I'm the RCGP Women's Health Champion. The definition of heavy menstrual bleeding is excessive menstrual blood loss that causes a significant impact to the well-being of a woman. The number of women who experience heavy menstrual bleeding is unknown because lots of women won't report the problem. They think it's something they must live with. So estimates are probably over 1 in 5 women will experience heavy menstrual bleeding in their lifetime. There was a recent survey of women who had heavy periods, and what they found was, when answering the questions, that 75% of women said they'd experienced anxiety because of their periods. And interestingly, that was more than the 60% of women who said they were actually having problems with their physical health. NICE HMB guidance was updated last year. This is a really important document because we have so many women attending our surgery with heavy periods, and it's a great resource for GPs to familiarise themselves with. So the changes to the recent NICE guidance are firstly about really understanding this fact that we need to concentrate more on the patient experience and the problems that they have with heavy menstrual bleeding on the impact of their lives, rather than concentrating on the amount of blood loss itself. And also it's about providing patients with more choice about their treatment options. The Wear White Again website is an excellent resource site for women and healthcare professionals to look at for patient information, treatment options, and useful resources such as period diaries. The treatment of heavy menstrual bleeding really depends on whether you find a cause for it initially. So if a lady has fibroids or endometrial polyps, then removing the fibroid or the polyp may solve the problem. If she has no cause found for her bleeding, then the treatment can be put into 3 different categories. Firstly, there's non-hormonal medical treatment, and that would include tranexamic acid, and any of the anti-inflammatory medicines would also help, and sometimes people use a combination. The second category is hormonal treatments. Now, this really depends whether the woman wants to retain her fertility at this point or not. And the hormonal treatments will include the use of the levonorgestrel intrauterine system, the combined hormonal contraceptives, if she is fit and able to take any of those, or long-cycle progestogenic therapy. And then we get on to the surgical treatments. And in the surgical treatments, then she could choose to have the endometrial ablation, such as NovaSure, or hysterectomy if she's been fully counselled about all the risks. Endometrial ablation is an extremely effective procedure to use in women who do not want to become pregnant ever again. Healthcare professionals can really support women with period type problems, firstly by listening to them and supporting them and allowing them to share their concerns. Secondly, we can signpost women to good information resources, and we can offer them informed choices about their treatment.